Hello, my name is Kelly Fountain. I'm a Quality Improvement Advisor here at the Kentucky Regional Extension Center. And today I'm joined by Jessica Elliott, a fellow Quality Improvement Advisor. We're going to be focusing on the Quality Payment Program for 2021 program year, and really we're going to look at the MIPS track. Now, before we get started, I want to draw your attention to our disclaimer at the bottom of the screen. The information contained in this presentation is for general information purposes only. The information is provided by UK Healthcare's Kentucky Regional Extension Center, and while we endeavor to keep the information up to date and correct, we make no representations or warranties of any kind express or implied about the completeness, accuracy, reliability, suitability, or availability with respect to content. Now, for those of you that don't know, the Kentucky Regional Extension Center has been around for over 10 years now. And we initially started with helping practices adopt and implement certified electronic health records in an effort to improve quality and patient outcomes across the state of Kentucky. Throughout the years, we have adapted to help meet the needs of our practices and will continue to do so. So if you need help with anything, our list of services across physician services as well as hospital are there, but don't feel like if you don't see something on the screen, it's not something we can help you with. We are continuously adapting to try and make sure that we are your trusted advisor and partner across the state to help ensure that you maximize quality, outcomes, and financial performance. Now, before we get really kind of into the nitty gritty of the MIPS overview, I want to start with what actually brings about the legislation or the right from CMS to create the Quality Payment Program. The MACRA legislation was passed in 2015, enacted in 2017, and that MACRA legislation is Medicare Access and CHIP Reauthorization Act. And this essentially replaced the sustainable growth rate. It created the Quality Payment Program. Under the Quality Payment Program, there are two main tracks. That's going to be the MIPS track and the APM track, where MIPS is the merit-based incentive payment system, and APMs are those alternative payment models. You'll see MVPs and APPs on this list of glossary of terms. Those are actually subset below the two main tracks, where MVPs will fall below MIPS and APPs will fall below APMs. Now, Jessica, do you mind covering what makes somebody eligible for this program?
Absolutely. Well, CMS looks at several different factors to determine clinician eligibility for the Quality Payment Program. First, they look at the type of clinician, and we're going to talk more about that on the next slide. Then they look at the date that that particular clinician was enrolled in Medicare. Then they look to the degree of participation with that clinician, and if they're tied to any type of an advanced alternative payment model. That's also an influencing factor. And then they also look at the volume to which you provide care to Medicare patients. So they look at your billing and they look at the actual patients who are attributed to you who are Medicare beneficiaries. There are eligible clinicians who are exempt from MIPS, or there are different clinicians who are exempt from MIPS. One is if you are not one of the eligible clinician types that we'll go over here in just a moment. Additionally, you might be an eligible clinician type, but if you have enrolled in Medicare for the very first time, if this is your first year participating in Medicare, or if you've enrolled after January 1st of 2021, you would not be eligible for this year, but keep in mind you could be eligible for subsequent years. Additionally, you would be exempt from MIPS, the MIPS track of the Quality Payment Program, if you're determined to be what's called a qualifying participant or a QP in an advanced alternative payment model. And CMS uses a couple different snapshot windows where they look at your billing and your participation in those categories above. And that time frame starts from October in 2019 all the way extending into September of 2021. Now, when we transition over and take a look at the different types of clinicians who are eligible for the program, those are going to be located in that gray box at the top of the slide. So it ranges all the way from your traditional physician, MDs, and DOs, all the way through to registered dietitians or nutritional professionals. So there are quite a few different types of clinicians who are eligible for the program currently. Now, there's two main tracks for which you can participate in the Quality Payment Program. You can participate, as Kelly mentioned, in the MIPS track or in the Advanced Alternative Payment Model track, depending on how your eligibility falls. So if you're in that MIPS track, you have to meet $90,000 in Part B billing to Medicare. You also have to have at least 200 Medicare patients attributed to you, and you have to bill 200 covered professional services within that time frame of the performance year as well too. Now, if you're in that advanced alternative payment model track, it's a little bit different. You have to be deemed as a participant in a qualified and eligible advanced alternative payment model. So that payment model has to be something that has already been blessed by CMS to be able to be eligible for this track of the program. You also have certain thresholds as well around payment and patients. So 50% of your payments have to be processed through that APM model to Medicare. And the same thing with your patients. 35% of your Medicare patients, your Medicare beneficiaries, have to be tied to that APM. And then finally, how do you check your eligibility? How do you verify it? Well, the very first step you need to make sure is that you have a HARP account. Your HARP account is what creates your username and your password. It allows you to actually access multiple programs, but for us today, it allows you to create that identity to be able to access the QPP portal. So you can see the website to where you can log in and gain access to being able to create that username and password. From there, you can take that account information and you can log in to the QPP portal, where then you can link the TINs that are associated with your practice, with your clinicians, to your account. From there, you can help manage access, you can verify eligibility at the individual level, at the group level. You can do attestations and any of the different work that you need to do to help manage anything related to the quality payment program with this access in that portal.
Okay, thank you, Jess. So one of the things that you probably have picked up is that you have the eligibility either at the individual, group level, or both. Now, typically, if you're eligible for this program, CMS is going to define that at the individual level. And CMS defines that individual level eligibility as a NPI tax ID association. So essentially, it's an NPI that has reassigned their billing rights to a tax ID. And CMS sees that as a unique identifier. So that's an individual. And you can actually submit at that level. In addition to that, you could submit at the group level. Now, there are two areas in which fall underneath this group box, if you will. The first is if you have two or more eligible clinicians tied to a tax ID. So think NPIs tied to a tax ID through that reassignment of billing rights under a single tax ID, then you would submit at that level. So it would be everybody's performance under that tax ID submitted to CMS across the different performance categories. Now, in addition to that, there's that APM entity. It's a little bit different than the traditional group as far as it's not underneath one tax ID. It may contain multiple tax IDs, but this is essentially all of the NPIs that have reassigned their billing rights under that APM. Then their collective performance is submitted to CMS, and that's how they're evaluated. Now, depending on the APM itself, you may have different requirements to the program. So you may have to submit promoting interoperability, in which case you may still find yourself having to submit either at the individual level or the group level underneath your tax ID, depending on those negotiated contracts. Now, finally is the virtual group. Virtual group is actually where you have multiple tax IDs that have perhaps one or more eligible clinicians tied to those tax IDs. So let's say you have 2 or 3 tax IDs that have 2 or 3 eligible clinicians tied to them. What you could do is you could create a virtual group. And what would happen is that under that virtual group, once it's recognized by CMS, you would have the right to essentially do a single attestation to essentially qualify or satisfy the requirements associated with all of those entities that are tied to that virtual group. We don't see this be used as commonly at this point in time in the state of Kentucky. However, it is a good option, and then you should always keep that in your back pocket. Now, there are a couple of things that we wanted to cover. One thing in particular is really just the overview or the timeline for the quality payment program. And the timeline for the quality payment program is very much aligned across the 2 tracks. Jessica, do you mind walking through kind of the timeline we see?
Absolutely. So Right now, we're kind of in the area where we have last year still wrapping up, and we're beginning and setting the stage for year 5 of the program. So our attestation window for closing out 2020 performance began on January 4th and will actually run through March 31st of this year. And then we have our performance year that has kicked off for year 5, starting on January 1st and running through December 31st. Some other things to also keep in mind for the quality payment program are the rulemaking and the final rules that come throughout the year. So we tend to expect usually in the summer, early fall, we will get the notice for proposed rulemaking, and then we'll get the final rule typically in November, December. We also will get your feedback on your performance from the previous year, usually around June, July, August as well. And so again, it's a cycle that continues um, and starting again and wrapping up in December.
Okay, awesome. Thank you, Jessica. So in addition to that, kind of thinking about that timeline in particular, so we're in 2021 program year or year 5 of the quality payment program. And there are a couple things to consider in order to avoid the penalty. So that penalty, what's on the kind of stake or at stake is a 9% off the top of your Medicare Part B. You have to get 60 points or higher in order to avoid that penalty. Now, if you want to go for the exceptional performer bonus, you're really going to have to aim for 85 points or higher. And what this gets you is this is a budget neutral program. So not only will you get a positive payment adjustment associated with whatever funds are funded by those penalties, you'll also get a split of that $500 million pot of money. The closer you are to 100, the larger the percentage you'll see. Now, your program year is going to impact your payment year 2 years after. So program year 2021 is going to impact your payments beginning January 1st of 2023. Now, 2021 is a very special year for the quality payment program, as this is the last year for transitional MIPS. In particular, that means that $500 million pot of money, this is the last year that it is available. Jessica, what are some of the ways that practices can get over that 60-point threshold?
Well, I think you really, in order to be able to get over that 60-point threshold, you really have to be able to maximize your performance across your categories. And so, you want to take a look at, where we're at currently for 2021. Your quality category and your cost category, we've seen a shift and a change in that for this year, and we're going to be looking at 2022 and beyond. We're going to see that actually shift even further to where quality and cost are aligning at 30% equally. That goes in line with CMS's move to align quality and cost to align with their definition of what value is, where quality and cost meet at that intersection. And so I think really taking a look at, how you're maximizing your performance, and making sure that you are taking in all those opportunities to really examine and dig down into your quality, and then maximizing your performance, your promoting interoperability and your improvement activities as well are going to be very crucial to help make up that difference as we start to see those thresholds increase and that exceptional performer bonus as well to be able to hit that.
All right, wonderful. So let's talk a little bit about the 4 specific reporting categories. So just as a reminder, you have to get 60 points or higher in order to avoid the penalty. Jessica, what makes up the quality performance category?
Sure. Well, you have 6 measures that you are required to submit. The only exception is if you choose web interface as your method of submission. So if you use your EHR data and use a QRDA3 file to submit data, or if you use a QCDR or a qualified registry to submit data on your behalf, you do have to use those 6 measures. CMS web interface, as I said, is the only one that has that exception. Out of those 6 measures that you have to submit, at least one has to be an outcome or a high priority measure. Now, you do get some additional bonus points for any additional high priority or outcome or patient experience measure beyond that initial one. Something else to keep in mind with quality as well. With this year, with 2021, we have seen the addition of some population health-based claims measures. And so there's two that have been added again, there's nothing that you have to submit for. It's all based upon claims that you have submitted through CMS throughout the calendar year. So nothing that you have to collect discrete data for and submit, but it's something to definitely keep on your radar.
Okay, awesome. So kind of along those same lines is the cost performance category. So the cost performance category doesn't require you to take any action. Essentially, CMS evaluates your performance based across 20 different cost measures and determines whether or not you qualify or meet the minimum attribution or case amount to be evaluated. And then you're evaluated against your peers who also met the minimum case threshold for those measures. Now, measure one is Medicare spend per beneficiary. That's been around for quite some time. And measure two is total per capita costs per clinician. So that one in particular has had a slight tweak over the last couple of years, but for the most part, those two measures historically have been around for a while. In addition to that, we have 18 episode-based measures. These are very specific to different cases or episodes, and they're each going to have their own attribution methodology, as well as their own minimum threshold for evaluation. The thing that you want to know or consider about the cost performance category is because it's based off of claims data, you will not have any idea how you're performing on these until after the performance period has closed. So we won't anticipate getting any feedback for the 2020 program year, for example, until about summer, normally July of 2021. For improvement activities, Jessica, are there any major things that people need to consider?
There have been no major changes for 2021 as far as improvement activities go. However, as far as the category itself, you do have to have 40 raw points to make up your entire score. And you can reach that by doing a combination of medium and highly weighted activities. One of the main considerations that I always want to make sure I highlight is because this has been a change in the last couple years. This last year in 2020 was the first time we saw this actually being enacted, was that if you're reporting as a group, 50% of your eligible clinicians must participate in the same activity. And so that means you need to make sure that you're keeping all of the documentation for that activity, that your providers have been able to perform that as well too. Something else to also keep in mind as a benefit, if you are PCMH or PCSP certified across at least half of your TINs, that is something that can actually give you credit for improvement activities. So you definitely want to take advantage of that if that does if that's something that does fall into your wheelhouse.
Okay, fantastic. All right, so the last performance category is promoting interoperability, and we call it PI for short. This requires you to collect data and submit it to CMS. It requires at least 90 consecutive days, and you really want to get 100 raw points or higher if possible. There's only 110 points possible in total. Of course, it's performance-based scores. So the higher you perform on each of those objectives and subset measures, the higher your points associated with that will be. It requires you to be on a 2015 certified EHR. And if you're reporting at the group level, it needs to include everybody that uses your EHR if possible. There are some bonus points associated with e-prescribing of controlled substances and really using Casper to monitor that and ensure safely prescribing. So there are things that you need to do across each of these categories, but for the most part, cost is the one that you don't have to take any active role. Quality improvement activities and promoting interoperability all require some form of action. Now, let's think about bonus points in particular. There are bonus points that are added to your final score, and then there are bonus points that are added to performance categories. If we start with the bonus points that are added to your final score, we have complex patient bonus. This is going to be based off of the risk score associated with the patients that you treat. And CMS is going to define this or use your claims data to determine what your risk score is. Depending on what the average risk of the patient that you see, you may see a bonus of up to 5 points added to your final score at the end. Now, typically we don't see 5 points added. It's normally around 2 or 3 points for the state of Kentucky. It's added to the final, so you'll see that kind of tacked on at the end. Now for small practice bonus, high priority and outcome and improvement, as well as end to end, these are going to impact your quality performance category. And those are going to be bonuses associated with being a small practice or having fewer than 15 eligible clinicians tied to a tax ID, or selecting strategically. So the high priority or outcome measures, that's what Jessica was talking about earlier, where if you have additional high priority or outcome measures that you submit on in the quality performance category, you can see bonus points associated with that. And then finally, that end-to-end bonus in particular is really about creating and submitting electronically your quality data to CMS. Now, improvement bonus is around statistically significant improvements from year over performance. And then finally, there are up to 10 bonus points associated with the promoting interoperability performance category for e-prescribing controlled substances. We highly recommend that you utilize any bonus points that are available to you. Now, I do want to cover a few things that are coming up. This is just the start of this series. We will cover MIPS quality in February. We'll then cover promoting interoperability in April. And then finally, we'll wrap up with improvement activities in May. The goal of these short series is really to help you give kind of a foundational layer to somebody that perhaps hasn't been exposed to the quality payment program or the MIPS track education in the past. These are intended to be kind of used in conjunction with our monthly webinars. Now, thank you so much for your time and attention today. We hope that you found these beneficial. If you have any questions or concerns, please don't hesitate to reach out to us. We're really here to help. We want to ensure that not only are you doing the best you possibly can in this program, we want to make sure that you understand what's at risk and hopefully avoid any negative penalties associated with this program. Thank you, and we hope you have a wonderful day.